Hi all, I wanted to give you some direction and guidance regarding the evidence-based practice paper for this course. I've had a couple of students just ask some general questions, so I wanted to put together a little video to explain the purpose and how to go about the paper. So first of all, the main goal of this paper is to get you to get comfortable with what's in the literature, what's out there as far as research related information that would provide what we call evidence-based practice, right? So it's information, studies, findings that we see or that have been conducted that help guide how we should best practice, provide care for our patients. And so in this case, we're talking about women and newborns in the immediate newborn time period. So how do we take that information? How do we take this research, this evidence-based information, and translate it and move it to practice as a nurse? And so as a nurse and as a master's prepared nurse, we want you to be comfortable in being able to make that translation from evidence to the bedside. And so you've all have picked topics to look at. And so I'm just going to take one of these examples. So here I'll just use sitz baths here, right? So well, hydrotherapy is being highlighted too, but sitz baths. So you have this practice, and so in the literature, in the research, you're looking for an outcome. So the sitz baths decrease perineal pain after delivery, right? So that would be an outcome. And so you're looking for articles that would have some positive outcomes using sitz bath. Does it decrease the amount of time a woman is, does it decrease her postpartum recovery? So some kind of things, some kind of outcomes if we practice the use of sitz baths, right? Ice sitz baths, what does that do? Have we found anything in the literature that says we should be or should not be doing that, right? And so in this first area here, the introduction, you're going to give us a brief background about, you know, whatever your topic is. Is it about perineal pain or episiotomy pain after delivery? You know, women have, you know, pain after receiving an episiotomy. And so you want to give us a background, and at the end of that paragraph, you want to state the purpose of your paper. So the purpose of your paper is to, you know, look at the literature, examine 3 articles on the use of sitz bath to decrease perineal pain or something like that. So you want to give a brief overview of what the topic. You may want to define what your evidence base is. So like, what is group prenatal care? You want to do that in the intro. So then you're going to move down to the synthesis. So you're going to pick those 3 articles, research articles. And so we know there's multiple types of research. Quantitative, qualitative, where there's use of focus groups or random controlled trials, experimental, quasi-experimental. So there's various types of research out there. So you're not going to do systematic reviews or meta-analysis because these types of research have already done the synthesis for you. Surely you can pick out some of those articles within a meta-analysis or systematic review and do your own synthesis. So it has to be 3 different topics or 3 different research articles that focus on your evidence-based practice, right? So focusing on sitz baths, the use of sitz baths. And so you're going to, for each one of those articles, you're going to briefly be succinct in describing what type of design it is. Was it a large sample size, and give the number of the sample size? What did they do in this research, and what were the findings? And so if you say something is significant, then you need to give some type of, you need to give the statistical significance to that. So not just saying it was significant, but what was the p-value, or what was significant, right? And for each one of those articles, you're going to do that. And then you're going to give the state level of evidence. And below here, as you can see highlighted, I've given you links to help guide you to describe, so you can determine what type of level of evidence your research is. Is it a level 2? Is it a level 3? Is it a level 4? And so you use these, and you may find other sources as well. But once you state what that level of evidence is, then you need to cite where you got that from. So even if you use one of these links here, cite that within your paper. And then lastly, which students tend to forget, is that you're going to compare and contrast those three. You know, what things were alike? You know, were the findings similar? Was there some convergence in the findings between the three? So do some comparison there. And so this is a big part of the paper, as it's worth 30 points. So make sure that you get that part down. Now, after you've synthesized and you've gone through the literature, now you're going to make a statement on what's your stance on this topic. So based on the evidence here, you know, ice sitz baths should be used to decrease episiotomy pain in women. So that's what you're stating. That's what the articles, that's what the research has suggested. And so after you've stated that, now I, as the nurse, what am I going to, how can I as a nurse, sorry there, how can I as the nurse move this practice, this evidence-based practice, to the bedside, right? And so this is more than just the tasks, because we're not, you know, being a master's prepared nurse, you're not just dealing with the task of, I will supply the woman with, you know, I will give her a sitz bath, I will help her with the sitz bath. It's more than those simple tasks. So things like, you want to, you know, maybe you're teaching a prenatal class, and or a childbirth education class, and education, right? So you inform families that this is an option, and describe what it is, right? You may need to, you may want to talk to your unit and implement some type of unit change, in that you develop some guidelines in how to use sitz baths, with giving the evidence that this is, providing evidence that this is a evidence-based practice that's been shown to be positive in decreasing pain. And so therefore we as a unit should adopt this practice, and these are the steps that we should do, right? Something else that you can do is talk with the providers, the primary providers, and their discussion in if they're writing orders for pain medicine, maybe suggesting to add sitz baths, you know. So thinking outside of the box, and not just with those just tasks, right, that we're going to do anyway. It's about bringing that evidence to the bedside. How do I do that? How can I do that as a nurse? And it's pushing you to think that as nurses, we do have autonomy, and the ability to make change, to implement change, right? And so this is what that section is. And so for each one of your actions, you want to give some rationale of what it is that you would do. Then lastly, if you're doing this individually, lastly, you would provide a summary, right? So you're just kind of recapping everything that you've done in those other paragraphs, right? And then making sure that you talk about the importance or the role of the nurse in implementing this evidence-based practice, right? Be careful about APA with in-text citations and with your reference list and with your title page. You do not need an abstract, but you do need running head in the proper capitalizations and everything, proper title page. And so making sure that you don't lose lose any points off of APA. So use the most up-to-date APA format there is, and then you submit that in the Dropbox in Canvas. If you are working with pairs, everything is the same except this highlighted area here that you need to provide, you and your partner need to provide a paragraph, a statement or two that describes each member's contribution to the paper. Who did what, right? So that we know that there is some equity in the distribution of work in this paper. And so I hope that this gives you a better understanding of what I'm looking for in the paper. Again, you have your evidence base, you have your practice here, continuous labor support or delayed umbilical cord clamping, and now you have some kind of outcome you're looking at. Does this help do this or does it not, right? And then you're going to provide some information, some research on that, synthesizing that, comparing and contrasting those articles, talking about the level of evidence, then make the statement of, okay, I'm for, or no, the evidence shows that we shouldn't use ice baths. They don't provide any benefit. So then therefore we should stop doing that, right? Because not everything is something that is a positive. It may turn out that this practice that we're doing isn't evidence-based, right? That there is no benefit from it. And then you're going to think about how can I, as the nurse, help to bring this information, bring this practice to the bedside, summarize, and making sure you have, you're using APA. Again, if you have questions, concerns, even after reading or listening to this, I am available. I am not reading drafts. I think that, it's clearly laid out here, and again, that I'm available if you have specific questions. Thank you, and I hope that this definitely helps. Bye.